get on with the topic of this video, which is congenital vertical talus. Let's talk about the X-ray film over here. So we're going to be talking about the bones of the foot here. You can see the tibia and the fibula, which are the lower leg, obviously. And here you can start to see the bones of the feet. Now, the talus is very important because this marks the connection of the lower leg, of the leg, to the foot. And the talus sits on top of the calcaneus over here, and it's joined. This is the calcaneus, and it's joined kind of like it's next to this navicular bone here. So we can call this joint talonavicular joint. Here's the cuboid, here's the metatarsal, and here's the sesamoid, phalanges over here. Okay. Congenital vertical talus is often also known as rocker bottom feet. This is a rare congenital condition which often presents with your flat foot deformity. We've talked about flat foot in the previous video, but now this is actually rigid. So the flat foot that we explored before were often flexible, which meant that the medial arch was visible when the leg or the foot was in the air, but as soon as the foot touched the ground, the medial arch disappeared, and that was the flat foot, and that was what characterized it as a flexible flat foot. Here, a congenital vertical talus is often is when you get this talus bone, which is currently facing and pointed towards the direction of the toes, is when this talus bone is infected. Instead of being positioned so it points towards the toes, the talus would then be pointed downwards towards the ground. So that is what congenital vertical talus is. It's a vertical talus. It's what patients are born with. Babies are born with this. It can be caused by a neuromuscular or chromosomal abnormality in neonates. Treatment would usually be serial manipulation and casting. And remember, serial manipulation was our process of repeatedly applying cast to allow for realignment of the bone over time and stretching. Okay, so demographics is a male to female ratio of 2:1. It's a rigid, the vertical talus congenital disease is a rigid flat foot with a rocker bottom appearance. This is what is known as a rocker bottom appearance. It's like the rocker bottom of a chair. The calcaneus is in fixed equinus, and if you remember what equinus was, it was kind of like when equinus of the foot would have been when the heel was lifted off the ground and you were on your toes, and in plantar flexion, equinus is the same thing here. The Achilles tendon is very tight here. The hind foot is in valgus, which means laterally deviated, L for laterally deviated, outwardly deviated. The head of the talus is found medially in the sole, and the foot is often abducted and dorsiflexed. Congenital vertical talus is the extreme case of flat foot. This is very serious and often very symptomatic and can change the way the patient walks, and it often does need to, after a series of non-surgical treatments, we often go to surgery. It's a rare deformity which is typically diagnosed at birth, and here you can see the talus typically should be pointing towards the toes, in the direction towards the toes. But as soon as we have a vertical talus deformity, it's vertically positioned and pointing towards the ground. Talus is very important because this is the connection of our lower leg to our foot. And also, if this, you can imagine if this talus bone is vertical, that means that all the bones in front of it are moved. In vertical talus, the talus points towards the ground, and you can see when the foot is bending upwards, here's the talus vertical. Again, and in maximal plantar flexion means feet planted on the ground, your talus is once again vertical towards the ground. Here is another example of rocker bottom feet, which we can see in this condition, vertical talus. So it's a rigid foot deformity. You have a dorsolateral navicular dislocation. What does that mean? That means that here is your talus bone, and here is your navicular bone. This navicular bone is literally, if you can imagine, if this is vertical, this will be dorsally displaced. So this is vertical, this is dorsally displaced. This is dorsally displaced, meaning this way, this way. So it's a dorsolateral navicular dislocation, a vertically oriented talus, and calcaneal eversion. It can also be due to soft tissue contractures such as the Achilles tendon. We've already discussed how Achilles tendon contraction often does cause this flat foot. It's also associated with a positive family history and a gene mutation. What does it mean by subluxation of the talonavicular joint? A subluxation means an incomplete dislocation. Here was our calcaneus, here was our talus, marking the connection between our lower legs and our feet, and here was the talonavicular joint. Subluxation means incomplete dislocation, and this joint becomes subluxated dorsally, because the talus is vertically placed now in this congenital condition. What are the causes of vertical talus, congenital vertical talus, or rock-bottom feet? It's bilateral in 50% of cases and idiopathic in less than 50% of cases. It can be caused due to neuromuscular disorder or trisomies 13, 15, and 18. Again, you are talking about dorsally dislocation of the navicular, equinus of the talus, and equinus and valgus, lateral displacement of the calcaneus and the foot itself. Now we have a differential diagnosis with an oblique talus. An oblique talus is a differential. It's a less severe form of this flat foot. Remember, this congenital vertical talus is the most severe form of flat foot that we encounter, which often needs surgical treatment. When it comes to oblique talus, the talus bone is positioned in the wrong direction while weight bearing. But the key here, the key to differentiate this from a vertical talus is that in an oblique talus, there is realignment when the foot is pointed down. So talus realigns normally when the foot is pointed down, but when the foot is normal or weight bearing while the patient is standing, while the child is standing, the talus bone is again vertical, very vertical. It's less severe. It's a talonavicular subluxation that reduces with forced plantar flexion of the foot. Remember, this talonavicular subluxation, this abnormality, this dorsal displacement of the talonavicular joint actually resolves. It gets better when you forcibly plantar flex the foot. When the foot is planted downwards or forcefully plantar flexed, here you can see this is an oblique talus. Here's the talus, here's it being oblique. When the patient is standing, weight bearing, or when the foot is bending up, in either of these conditions, when there's weight bearing on the foot, the talus is pointed downwards, it's vertical again. But again, the key for the oblique talus is that as soon as there's plantar flexion, in this image you can see that there's plantar flexion, and you can see all the way down that the talus is realigned. So the talus becomes realigned, and that is the key differential between an oblique talus and a vertical talus. Remember, an oblique talus, the talus bone is once again in the wrong direction. It's not exactly vertical, but it is oblique, and it changes in the two conditions, in the two stances of the patient. If the patient is standing, weight bearing, then in a vertical talus, so this one should say oblique and this one should say vertical. These are the wrong way around. So if, let's say oblique talus is over here, ignore the vertical. Let's say oblique talus is over here. Oblique talus being over here means that when you're weight bearing, the talus is in the oblique wrong direction. But as soon as the foot is pointed down, it's realigned. It's aligned the right way. Once again, that is for the oblique talus. Just to clarify, this is a mistake with this table. This should be oblique talus here. Vertical talus stays in the wrong direction, vertical in both conditions, whether you're weight bearing or not. So this would be a vertical talus, and if the foot was bending upwards, or when the foot was pointing downwards in plantar flexion, it doesn't matter how you change the position of the child, the talus will always be pointed downwards vertically. But that's an oblique is spared from this. treatment of the vertical talus can be, when it's conservative, when it's non-surgical, you want to do a serial casting technique, which involves repeatedly casting the talus in the foot, repeatedly casting the foot until you achieve stretching and realignment of the talus. And it obviously takes a long time, and it requires repeated casting, and this is non-surgical. The goal of the treatment is obviously to correct the vertical talus deformity, and the surgical treatment would be to lengthen the tendons and the muscles. Surgical treatment would be to lengthen the tendons and muscles by surgical release and talonavicular reduction and pinning at age 6 to 12 months. There's another condition where you have talocalcaneal coalition. Here is your talus. Here's your calcaneus, here's your talus. They have a joint. Talus, calcaneus, talocalcaneal coalition is a form of flat foot. Is another form of flat foot. Here again, you can see the tarsal coalition. Here is the normal, here is the coalition. And that is the end. Thank you for watching this video. I hope it was useful.